Scopolamine, also known as Hyoscine, is an anticholinergic medication derived from plants of the nightshade family. It is primarily used to prevent nausea and vomiting associated with motion sickness and certain surgeries. It is available in various forms, including transdermal patches, oral tablets, and injectable solutions. Scopolamine is widely used to prevent motion sickness, including nausea, vomiting, and dizziness. It helps prevent postoperative nausea and vomiting, especially after anesthesia. It is sometimes used off-label for irritable bowel syndrome, to reduce abdominal cramps and discomfort. It may be used in Parkinson's disease, to control symptoms such as drooling. And finally, in palliative care, it is helpful in reducing respiratory secretions and calming terminal agitation. Scopolamine works by blocking muscarinic acetylcholine receptors in both the central and peripheral nervous systems. This anticholinergic action inhibits the nerve pathways that stimulate vomiting. By acting on the vestibular system and the vomiting center in the brain, it effectively prevents motion-induced nausea. For motion sickness, the most common form is the transdermal patch. One patch, containing 1.5 milligrams, is applied behind the ear at least 4 hours before travel and lasts up to 72 hours. For oral or injectable forms, the typical adult dose is 0.3 to 0.6 milligrams every 6 to 8 hours as needed. For postoperative nausea and vomiting, one patch is usually applied the evening before surgery or 1 hour before a cesarean section. In irritable bowel syndrome, an off-label use, oral doses of 0.3 to 0.6 milligrams may be taken up to 4 times daily. Common side effects include dry mouth, drowsiness, blurred vision, dizziness, and constipation. More serious side effects may include confusion, particularly in the elderly, hallucinations or agitation, difficulty urinating, rapid heartbeat, and increased eye pressure. Scopolamine may interact with other anticholinergic drugs, intensifying side effects like dry mouth or blurred vision. It can also enhance sedation when used with central nervous system depressants such as alcohol, opioids, and benzodiazepines. Tricyclic antidepressants and some antihistamines may also increase anticholinergic effects. Lastly, monoamine oxidase inhibitors, or MAOIs, may raise the risk of adverse reactions. Caution is advised in elderly patients who are more vulnerable to confusion and central nervous system effects. Scopolamine should be avoided in individuals with narrow-angle glaucoma, as it can increase intraocular pressure. Patients with enlarged prostate or urinary obstruction may be at risk of urinary retention. During pregnancy and breastfeeding, it should only be used if absolutely necessary. The transdermal patch is generally preferred in such cases. Because it may cause drowsiness or visual disturbances, patients should be warned not to drive or operate heavy machinery until they know how the drug affects them. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.